When you have a thyroid problem, that's one of my specialties. So I treat a lot of patients for thyroid dysfunction, thyroid pathology, just hypo. Recently we've seen a lot more hyper than we've ever seen. I used to see one every 5 years. Now I see 4 or 5 a year. I mean, that's definitely from chemicals and toxicity in the environment. The allopaths have their own way to do it. We have our way. And most of the time it works. I mean, I'm not afraid to refer either. I'm not like a proud doctor. If it doesn't work, I'm going to try to find somebody else to help you. But I don't usually need to. And so you got your Hashimoto's, which is the real serious form of hypothyroidism, which is where your thyroid's getting attacked by your own immune system. And autoimmunity is what's been on the rise a lot in the last 10, 15 years because of all the chemical toxicity, all the allergies, the stress, and the gut. And now, obviously, we learned in naturopathic school, always treat the gut because your gut is 75% of your immune system is in your GI tract. And that's your flora. And they're just starting to do a lot of research on the flora. Like they elucidated the whole human genome. They knew every single gene, every SNP. Well, they're starting to be able to do that with the human biome in your gut. And I'm going to tell you that human biome information is going to be like 1,000 times more important than the human genome. It's going to be everything. When they figure out all the different flora in your gut, how much they're supposed to be and all the different types, that's basically going to tell us how to treat you. We're going to know very scientifically because the immune system is in the gut. So we're going to start with that. And a lot of your hormones are made in the gut and a lot of your neurotransmitters are made there. So that's something we're going to go look at right away. The thyroid has been one of the worst diagnosed pathologies, I think, in the history of I don't know, of the world, let's just say. And now I believe we're in kind of an epidemic, if not an international pandemic, with subclinical hypothyroidism. And this is a term coined, I think it was coined by Dr. Wilson. And that was also, he was one of our professors. And Wilson taught us that there's something called Wilson syndrome. Well, Wilson syndrome basically says your labs are fine. If you're looking at it a certain way, your labs are fine. To the regular or just the average doctor doesn't know about the research or anything, okay, TSH is all they measure. I'll get into that in a minute. But you have all these symptoms of hypothyroidism, and they're not anything else. And I'm going to guarantee those patients, you could prove it if they take their temperature in the morning, first thing in the morning. And in Europe, this is the way they diagnose hypothyroidism. They take your first morning temperature before you move out of bed. As soon as you start to move, your temperature goes up. They'll take a temperature, write it down, and they'll send a doctor every week. I have about half my patients are doing this right now. And you can see the pattern, and you can see they're coming at 97, 97.1, 97. They don't go above 97.5. And that's to 97.5 to like 98.5 or 97.5 and below, or even up to 98 or 90, well, 97.5, you're going to basically see thyroid. If you're 98 or sometimes 97.8, 97.9, 98, 90, that could be adrenal. But a lot of doctors, what they don't know is if you treat the thyroid, you almost invariably have to treat the adrenals because you have the hypothalamic pituitary axis, and that's from the pituitary to the thyroid to the adrenals. This is a very important axis. Well, for one thing, it's all your energy, right? For two, it's all your weight. So we're in California. So everybody wants to be beautiful, or at least not have a big old belly and be fat. So they want to fix this. So a lot of times we need to look at that right away. I need to look at what are their temperatures? What are their 7 thyroid labs I'm measuring? I measure every panel the first day. I don't reflex to something. Like a lot of doctors will find something wrong. Oh, we don't want to order too many labs because of price. No, we have one lab. Every insurance covers except for Medi-Cal. Every other insurance covers 100%. They never came back at the patient ever. Talking 30, 40 pages. So I make sure we have 7 thyroid labs in there and all your other hormones too, because the thyroid is the interplay of your other hormonal organs as well. So you have to understand this. And if you look at the research that Holtorf did on TSH, and Holtorf basically says TSH is a really bad lab. It's only going to, like, for me now, after all these years, the markers, the level of TSH, I think it goes up to 4.5 or 5. I've seen people in bed when they're at 4.5 or 5 because their thyroid was so poor, the history and the working of the thyroid, they couldn't even get out of bed. So usually what I'm doing now is I look at 0.5 to 1. Even, I want everybody to be below 1, but if you go too far down, you're going to have hyperthyroidism. So I want them right above hyperthyroidism, just in the top or the bottom row of hypo. So those patients, they have energy, they don't need to take naps. Okay, another thing is they come to me, and this is a symptom that people, if they see this video, they say, I'm eating less food and I'm gaining more weight. How could that be? How could you eat less and gain more weight? Well, it happens. It's like a phenomenon in thyroid, and somehow the water weight, maybe their water's being held onto their body. You do get a lot of edema when you have hypothyroidism. So you start to get pudgy, this thing called facies, you'll get like all this pudginess, and estrogen dominance, similar. So we ought to differentiate between those two. But hypothyroidism is just one of the worst problems because when I see the patients for years, they've been put on Synthroid. Now, if you look at Wilson's work, Synthroid is a pharmaceutical that's just a knee jerk. Everybody who has hypothyroidism, not everybody, but the majority of patients in the allopathic world are going to get Synthroid. Synthroid's a bad drug. And I didn't do the research, but I did my own research with my own patients, and I see what happens to them. So Wilson said basically in his manual, because he's been fixing Hashimoto's for a long time, and that's the Hashimoto's I'm talking about. It's a very serious autoimmune attack on your thyroid, and you can't get out of it. You can't fix it by yourself. He writes in his book that the T3 receptor, so you have T4 and T3. There's other T's too also, but we're just talking about the T4 and the T3. They're the major ones. Well, T3 is your active form of thyroid. It's 80% active, but it's sequestered because if it was to get out in the body, your heart would start beating like so fast you could die. Literally, go into a thyroid storm. So it's like a pinhead is all you need for one day. So it's kept. So basically, the T4 gets turned into the T3, so that the body has to be able to do that transition. There's a lot of things like stress, cortisol, birth control pills, a lot of things block that conversion of T4 to T3. If you're using just T4, you're getting 20% action, and that's what Synthroid is. Not only is it just T4, but it's a pharmaceutical made in the lab that's just T4. So already it's going to fail. I don't care. I just need to hear that, and I can show you the research. I mean, okay, granted, there are naysayers out there. I know, and it's worked for some of my patients. It's very few. It's like 1 out of like 300, really, that I've ever seen. So when my patient first comes in, if they definitely are on that, I take them off. Like day one, I just take them right off. And then we usually put them on Thyroid, which it works pretty well. It's a good drug. It doesn't have, I'm the first one to tell you the doses aren't always exactly the same because it's from a porcine source, porcine thyroid. But we can use that, but we also use a sustained release T3. So now we use a sustained release over time. So T3, they used to use it without that, and if you do the wrong thing, the thyroid can do that thyroid storm like I was telling you. Your heart can start palpitating, they feel terrible. But if you do the sustained release T3 at low dose, it's just little by little raising their thyroid up gently, and we also add some T4 to it to buffer it. But with my patients, I usually use a higher dose of T3 and T4. I've seen that work best, and I've seen them completely break out of Hashimoto's. And I'm going to tell you, Hashimoto's is one of the worst diseases for feeling bad, for being depressed, because you're getting a hardwired. When your thyroid doesn't work, you have a hardwired depression. You can't fix it. It's not like you're grieving or something while you're depressed. That you go in and out. It's like a spiritual experience. When you're death of a loved one or something, you're kind of cast into being very close to God. You're very close to your spiritual realm because you don't know where else to do, and that's kind of where everybody needs to be, but they're only forced to do it when they have to do it. I mean, some people. Definitely. It takes a while, it's not easy, but I've seen antibodies that were thousands, and I've gotten down to 0. So it takes 6 months to a year for some people. If it is a big bolus of chemicals that's affecting them every day in their house, okay, it could be heavy metals too. A lot of times, so if I think it's heavy metals, or ask them if their hands are numb and tingling and their arms are falling asleep all the time, their brain fog, or they have mercury in their mouth, I'm going to tell them, get the mercury out right away. Get regular fillings, then we'll start to work. Then we do the heavy metal test. If they're off the charts, we start chelating them. A lot of times the Hashimoto's will go away. But it's also, so heavy metals, toxins, could be virus. It could be some kind of virus that's attacking the thyroid. So we got to elucidate that. We got to find that on another lab. It's just not simple. A lot of stuff. Allergies, dysfunctional gut flora, toxins, chemicals, stress, like severe anger, like rage, can interfere with your thyroid. Thyroid in general is triggered a lot of times by the brassica family, the broccoli, cauliflower. There's a whole family, the sulfur, and those are really great. You want to eat those and cooked. If you eat them raw, though, a lot of raw foods, certain raw foods can trigger the thyroid to have problems or exacerbate the already. I don't know if the foods are so important. I think if you don't have a thyroid issue and we fix the thyroid, then you could probably eat those foods, but I wouldn't tell you to eat them raw, though. You're supposed to eat them cooked only. I think most of my patients don't complain about having any pain. They say they feel swelling sometimes, and they feel like maybe it's pressing on their voice box a little bit or on their larynx, but Not a lot, not here. It's just a systemic illness because it's the whole thyroid's slowing down. But also, I neglected to say before, some patients have Hashimoto's where it ramps up and their heart's pounding, like they have hyperthyroidism. And the next day they're down and they're up and they're down. So it's almost like the autoimmunity. Autoimmunity is just like cells like destroying your thyroid. They're chomping at it. They're trying to kill something that's not there. And what happens is then it can dump a whole bunch of hormone out in the body. Or it could suppress the hormone from being made. It could be bad. I mean, people can feel horrible, and if it gets too far gone and your thyroid isn't working very well, your heart will fill up with plaque, fill up with a lot of your cholesterol go up. I can't say that it causes diabetes, but a lot of patients, when they start having all those problems, they have insulin resistance too. But a lot of them it's hard to tell because you could be eating a lot of sugar, carbs, which drives up the insulin. But for sure, their lipids page, their fats are all off, always. And their inflammatory markers are through the roof. Hair falls out, skin gets rough, skin gets, well, not just skin, but under the skin, a lot of edema, water weight, you'll get fat, you'll be exhausted, your brain fog. Okay, so another thing is if they have there's real pure-blown Hashimoto's, which we can tell. We measure two antibodies. We measure TG antibody and TPO antibody on every lab. That's part of the 7 thyroid hormones I measure, and those are high, you have Hashimoto's. So it's easy to see. But they will also not remember anything. Because those patients are really bad with Hashimoto's, and they get healed and they come back like maybe a month later. They tell me, Dr. Churchill, do you realize it? I didn't even remember anything you told me on the first visit. I couldn't even, and you'll be explaining stuff to them, and they'll be looking at you, and you'll kind of explain like they're not there. They're literally, when the thyroid goes so low, their brain does have no power. They can't remember anything. They have such a hard time. They get so frustrated because they're trying to even just find their keys, open the car. It's a horrible state to be in. Because you don't look like anything really wrong with you, but you cannot function in the world. And you may get in an accident or something. You've got to be really careful. If your thyroid's that low, you're going to be just so exhausted that a lot of them end up in bed. And that's where you don't want to go, for sure. That's where we can fix that before that happens. I do a lot of labs. I fix all the hormones. I balance all the hormones. I usually put them on a sustained-release T3, T4 combination. I get them off Synthroid. I fix their diets. I get rid of their stress as much as I can, their sugar, any alcohol, caffeine, kind of 1 cup of coffee a day, that's fine, but lifestyle changes usually will do it. The sustained release T3, T4, it can be, some people will only take it for a few months, a lot of people just like it, they just stay on it, and we have to adjust the dose. As they get better, they'll get lower, and if they're not getting better, then we'll usually in the beginning start slow, and we ramp up just till their temperatures go normal and they feel like they are healthy, like they feel like they're not depressed anymore, they're not tired. You can tell easily. I mean, it's like they just snap like that. It's all finished. I mean, a patient the other day, we gave her iodoral, and that's what I was telling you, she just slept like a baby. And I could see she's not doing HCG anymore. She's not fat. She's not gaining all that weight. Thyroid controls metabolism, just slows everything down. There's no way you can lose weight when you have thyroid pathology, let's just say. Hypothyroidism. Hyperthyroidism, you lose all kinds of weight. So you can see what it does. It speeds up everything. So hypothyroidism slows down everything. They're like turtle. I call all my patients, they're like turtles. Because hyperthyroidism, you could die if you have it too long. I mean, it just wears your body down. Your heart will become, it'll become like congestive heart failure. It'll just beat so many times and it'll get distended. It won't be able to beat properly anymore. So those, a lot of times, they don't remove it, they irradiate it. And that one I wouldn't recommend unless it's like a last resort. And there's drugs they put them on, and we have a whole protocol for that. Most hyperthyroidism, I know a lady actually from Pasadena, she's still doing great after like 6-7 years, and she still has it, but she can live with it now. We got it normal, so her heart's not beating too fast. The wheat molecule has the same DNA as the thyroid receptors, almost exactly the same. That's why wheat is so detrimental to a lot of people, because as soon as those, okay, so this is autoimmunity in short form, 101, right? So your gut basically has a lining here, it's the blood, and then you have the tube from your anus to your oral cavity going through your body that's dirty, so the body wants to wall it off, but right on the outside of that, in certain places, the nutrients go into the blood, because they have to diffuse into the blood, small intestine, right? So if you have particles of food, so say you have a leaky gut, this is a leaky gut, this is the walls of the gut, it's supposed to be like that, but then you have a lot of bacteria, candida, fungal infections, chemicals all pushing the cells apart. So then you have a food that's not digested. That food goes into the blood. Oh my goodness, it's like Armageddon. The body will remember that forever and it will destroy it. Because it only knows the things that when you were young, when you're a baby, it finds out all the foods it's supposed to know. It knows what a protein is. It knows what one sugar is. It knows what one fatty acid is. But if those things are connected, it didn't learn that in utero. Friend or foe. This is what happens when you're a kid, or else you couldn't live. Everything you ate would get attacked. Your immune system is really incredibly powerful. So if it attacks your body, you're in trouble. So what we do is we do probiotics, we do a lot of different things. We kill off the candida. I use nystatin, I use a natural one too. And so the gut shores up like that. Then all these candidas are going, they're not punching holes, and those foods aren't going in there. So once those foods go in there, especially wheat, well, if the wheat base pairs, like the DNA of the wheat, is the same thing as the thyroid receptor, don't you think the body, when it's going by the thyroid receptor, is going to attack it? Because and it remembers everything. So it remembers that wheat molecule that came into the blood. That's systemic for the whole body. It's like amassing the whole, I don't know good analogies, but it's like getting the National Guard to go to every single person's house in the whole country to find something or to kill it. So I find that wheat molecule, which is actually from wheat, but it's actually on your thyroid, and it's gonna destroy your thyroid. Wheat's adulterated. Why wheat is the worst food? Probably the culprit of all foods now, and it's measured in parts per million. Wheat is actually measured in parts per million, like a toxic chemical now. For some people, it's so toxic with celiac, it can destroy them. Because it was adulterated, I think in the 40s or 50s, it was the first experiment they did on our food in America. They've done a lot of experiments on our food, they just don't tell us. They genetically modify it. The wheat's that's the beginning, that's why it's so serious. But not just the wheat, because the wheat will blow into the other fields. Like say you have wheat on this side and you have another kind of grain on the other side. Literally if the wheat blows, because wind blows, right? And it goes onto that, they have to measure that when they put that in the packages and say there's wheat in here, because it's become so toxic. I guess the point I'm trying to make is that Wilson talks about the TSH not being an accurate lab to use, and that the thyroid receptors for the T3 are shut down. So if all you're on is just Synthroid, which is T4, your thyroid receptors for T3 are all shut down. You can imagine how it's not going to work very well. And a lot of those patients, they keep coming back, and they'll get the labs, and their TSH will be kind of in the normal range, quote unquote normal, and they'll say, well, I feel terrible, I feel horrible. Well, I can't do anything. Well, please, can you give me some medicine? So they get a little more Synthroid. So they start at like 65 milligrams, like 1 grain, and they go up. By the time they're here, they're 150, 175 I've seen, of Synthroid, and their thyroid isn't working. And their temperatures in the morning are all low. So we have to get it out of there. But the problem with that is in Wilson's and what I've seen is that the ones that are on the Synthroid the longest, they have the hardest time to heal. It could take years because it does something to the thyroid, that drug. That's why I want to get them out completely. Basically, so we get them on the other things. And they work much better. So basically, if they come in saying, I'm gaining weight, but I'm eating less, or my hair's falling out profusely, or they lose the edges of their eyebrows, the 1/3 here is like completely gone, that's all pathognomonic to thyroid pathology. And we could help them. And I help a lot. That's my favorite thing to work with. I've been able to help everybody with those problems. So.